through being involved with the VVMA and being on the board of veterinary medicine, I was introduced to the AVMA Future Leaders Program, which is a pretty intensive year-long commitment.
I know that you're involved with organized veterinary medicine, and probably a lot of people don't know that side of what you do, and
sure.
what all veterinarians do in the state level and so forth.
Okay, yeah, great. So a couple years back, we actually started the Southside VMA, which a VMA is a Veterinary Medical Association. So Southside VMA encompasses Danville, South Boston, Halifax, kind of up to Lynchburg, because Lynchburg has their own region. So when we started our region, we needed a director for the region, and I was asked to be the director, and I'm like, oh, I'm not sure what that is, but I guess I called the VVMA office, and I talked to Robin, and she's the executive director for the VVMA is the Virginia Veterinary Medical Association, and so they kind of help with legislative issues, and they're just an organization of our members in the state of Virginia. So what being the director for our region entailed was going to the VVMA board meetings, which was kind of intimidating at first, but I really got to know some other leaders in our profession, and I got to understand how the profession works as far as organized veterinary medicine, and how it seems just like an organization, a club. It's what it seemed like until I really got deep down into what they do, and they really do help protect and benefit our profession and promote our profession a lot. So they actually have a lobbyist that they work with to talk to. The Virginia Veterinary Medical Association helps talk with veterinarians throughout the state to figure out some of the legislative issues and how it impacts our profession, how it impacts our day-to-day life, how it's going to impact the clients and the pets themselves. And then they go back and talk to the congressmen to try to help work with them to get the bills passed in the most effective way possible for the profession. The prescription monitoring program, for instance, is one that's been in the legislative issue a lot lately. Last year they passed where any controlled drug, you had to only dispense 7 days worth, or you had to sign up for the prescription monitoring program, which you had a choice of which ones those could be, but there's a lot of regulations and stipulations behind that. So most clinics...
if you were like a pharmacy, that's really not a big deal. And I think that a lot of that legislation goes through on the human side, is that, we want to control these opioid addictions and these problems. But for veterinarians who keep a little tiny pharmacy inside their clinics, and some small, there's some little vets around town, around the state, that just have a one doctor shop, and they have one little bottle of pills, and when they have dogs that are really in pain, they need to have those certain pills, and then these regulations come under.
Correct, and we're allowed to dispense 7 days, and then we have to send it to an outside pharmacy, which is fine. I mean, most of the time you can get the drugs at a human pharmacy. However, as you know, a lot of the drugs are either hard to get or different drugs than are available at a human pharmacy. They're slightly different ratios, especially if there's two drugs in one. Hydrocodone is one, for example. That the ratio is different in the human medications. So those are the kind of things that part of what the VVMA does. Plus, they just collaborate veterinarians to get together and work as a group and as a collaborative effort. I mean, we are a very close-knit community. So regionally, we want to be able to do what's good and talk to each other and have relationships, and then a step larger in the state, you want to do that. And then I was, through being involved with the VVMA and being on the board of veterinary medicine, I was introduced to the AVMA Future Leaders Program, which is a pretty intensive year-long commitment where I worked.
So the AVMA is the American Veterinary Medical Association.
Yep, so they do the same thing that the VVMA does, but at a national level. And so I did a leadership program through the AVMA, and there were 10 of us in that group, and we worked together for an entire year. We met in Chicago 3 different times, and then I believe it was in Indianapolis at the AVMA convention, and we actually developed a leadership a packet to go to the AVMA that they could put on their website to help other veterinarians understand conflict resolution was our main topic that we did.
So that's a great, wonderful resource for us because again, you think about the little vet in his office with 5 to 7 employees, or we've started to outgrow that, and now we have 20 people here, and so it's gotten to the point where not everybody is in the building on any given day. So then communications become an issue, and so then you have like more of this corporate structure. How do we communicate with each other? How do we work out differences? How do we get along? How do we get a training schedule? And those are things like, those are nothing that we learned in vet school. Well, I do want to say you are awesome,
well,
and
thank you.
Thank you for being here with us. And we really appreciate the stuff you do with the AVMA and the VVMA, because those are those kind of things that that organization has really helped us. And I think the local SVMA, which you're instrumental in getting going, this Southside Veterinary Medical Association has brought all the local vets together, and it's really, I think it's helped grow our connections, because we all work so many hours, we sit inside our own clinics, we don't see each other unless we bump into one another at a conference or something. But so I think it's really helpful, and I think that the kind of projects you're working on help organize us and give us tools to do things better.
Yeah, I think that's important. I think you're absolutely right. The Southside VMA has brought the veterinarians in this region together, and I have to say I appreciate you, kind of not pushing me from the beginning and saying, you really should be involved in this, and supporting me and allowing me to do it, because a lot of vets that are my age don't have the ability to step out of the office for a day every quarter to go to one of these meetings. So the encouragement and the support is really important. So I do appreciate that a lot.
I'd like to add too, if I can, that
sure.
Both of you guys have helped me a lot in my personal growth, and especially Dr. Rohrig, with you've done a lot with the new and young leaders here. And
oh, thanks, Emma.
It means a lot.
Thank you. That's Emma, by the way. That's our medical team manager, and what she's referring to, she's gonna make me cry. Amy knew that I was involved with the leadership, and Dr. Smith knew, and they were like, well, what can you do here within the clinic? And I said, well, we have a manager within each of our teams within the practice, and so we have Emma, the medical team manager, we have Casey, the office manager. We don't currently have a pet hotel manager, but Amy's stepping in and doing that right now. And then of course we have Amy, who's our practice manager. So every other week we have a leadership development meeting. So we kind of talk about the different ins and outs of leadership development and management, and it really has become, we've become closer. I think that, as Emma said, she and Casey especially have really grown, and I'm so proud of them, because the last time we had our leadership development meeting, I found Emma was stepping up and leading the meeting, which is really cool. I was like, wow, they don't really need me anymore, which is not true. I mean that as a positive way. It's like I love seeing the growth, and I don't really feel like I've done that much for you guys, but you've stepped up to the plate and been there, so thank you.